Spinal stenosis in the lumbar spine. Stenosis means restriction or narrowing, basically pinching of the nerves. What causes stenosis? It's basically arthritis, degeneration, wear and tear of the disc and of the facet joints of the spine. Any joint in your body, when it gets arthritic, it gets bone spurs, joint hypertrophy, cysts, overgrowth of the arthritic joints, just like while your knuckles get bigger in your fingers. The arthritis and overgrowth, when it happens in the disc and the facet joints, that overgrowth will crowd in and pinch the nerves. Plus, the disc loses height. And we get shorter as we get older. You lose height because the disc collapsed down. All that closing down and arthritic overgrowth narrows the room for the nerves, which is what stenosis is, narrowing of the room for the nerves. How do you know if you have stenosis? The most typical symptom is when you stand, you get pain and tightness and discomfort into your butt, down the back of your legs, and can go below the knees and into your calves from standing. Standing is typically the worst. Why? Because when we're sitting, our spine is flexed open. There's a lot of room for the nerves. These are the nerves, these yellow tubes. A lot of room when you're sitting, your spine is flexed. When you stand up, it closes down. So the room for the nerves narrows, the blood gets cut off to the nerves, and it starts to ache. Just like when you exercise real hard and your muscles start to ache from a lack of blood, or you get a heart attack, which is pain in the heart muscle due to a lack of blood, these nerves get a lack of blood from the standing, which pinches the nerves, and after a minute or 5 or 10 or 30, that lack of blood supply starts to hurt, and it starts to ache, and it's really unbearable. So what do you do to treat it? You flex forward. People bend forward a little bit, or they bend over a shopping cart to open up their spine, or they sit down. If you sit down, it opens up and it relieves the symptoms. So typically standing is the worst, especially like at a cocktail party. When you're trying to stand up straight, talk to somebody face to face. That's when it's going to hurt the worst because you're trying to have good posture. And then if you start to walk, it typically feels a little bit better because we bend forward a little bit when we walk. But then after walking for a while, it's going to catch up to you because the stenosis is still there and the nerves are still getting pinched. So after you walk, if it starts to catch up to you and you need to sit down for the symptoms to go away, that's typical for spinal stenosis pinching the nerves. You can also have vascular claudication, which means the lack of blood supply to the legs can cause a similar lack of blood to the muscles can cause pain. But for spinal stenosis, it typically from your back, typically comes on from standing is the worst. Standing in one place is the worst. The vascular part, if it's a blood supply from the arteries and veins in your legs, it's more typical when you walk because you're using the muscles and they require more blood supply. Stenosis from the back, typical just standing in one place is the worst. You start to walk, feels a little bit better. But after you walk for a while, it catches up to you, you got to sit down. And the shopping cart's the classic. You bend over a shopping cart, it feels a lot better. It's probably spinal stenosis. And the pain can go down, it can just be in the back or go down the legs. The confusing part for us as physicians is sometimes it just stays in the back, it doesn't go down the legs. So therefore that pain in the back can be degenerative disc disease and degenerative facet joint disease in the back, or stenosis pinching of the nerves. How do we know the difference? Well, that's when a lot of times you have to come in and see us in person for us to sort that out. Depends on what the studies look like, the MRI, your exam, multiple factors. But in general, mechanical arthritic back pain when you use your back is arthritis in the back. Nerve pain is from standing that gets relieved by bending forward or sitting down. That's the easiest classification. Now, if the pain goes down the leg, that makes our job easier because the nerves go down the leg. So if the pain goes down below your knee, it's almost always nerve pain from the stenosis in the back because that's where the nerve goes, whereas the arthritis pain doesn't radiate down below the knee. They both can go into your butt. The butt's kind of the middle ground. They could both go there. So as far as which nerve goes down the leg, each nerve has a different number, goes to a different area in your leg. The L3 nerve goes into the front of your thigh, but not across the knee. That's L3, front of the thigh and into your groin. L4 nerve is the next nerve. That goes into the front of the thigh as well. They both go there. It crosses the knee to the inside of your calf, the medial aspect of your lower leg. So if the pain goes across your kneecap, when you stand, and if you sit down and it goes away, a lot of times that's an L4 nerve problem. So that knowing that type of stuff tells us what nerve may be affected. Then we look at the MRI and see if it matches. If it does, that's when surgery may help. The L5 nerve goes into your butt, goes down the back of your thigh a little bit to the side of your thigh. Then it goes down to the side of your lower leg, the outer part of your calf. Then it goes to the top of your foot into your big toe. So again, if the pain goes down in that distribution, and then we look at an MRI and see that your L5 nerve is being pinched, typically L4, L5, or L5S1 out in the foramen, well, then we probably know what's causing the pain. And lastly, the S1 nerve is the bottom nerve right here. It goes into your butt, goes into the back of your thigh, then it stays in the back of your calf and goes to the outer part of your heel. So how do we know which nerve is which? And let me say one other thing, because this confuses people. The L5 and the S1 nerve roots, they join together in your butt to make the sciatic nerve. Then the sciatic nerve goes down and branches into the perineal and the tibial nerves. So people talk about sciatica, when they stand, they get sciatica. As a spine surgeon, that's too generic for me. The sciatica is either the L5 or the S1 nerves. The sciatic nerve is just electrical tubing of how the L5 and the S1 nerves go out and go down into your legs. So sciatica is a very generic term. We want to know, is it the L5 or the S1 nerve root? How do we know the difference? It's when it goes below the knee. The L5 nerve goes out to the side of the leg, to the top of the foot, to the big toe. The S1 nerve stays in the back of the calf and goes to the heel. So if you can distinguish between those two, it may tell us which nerve is being affected, L5 or S1. And to reiterate, between L3 and L4, they both become the femoral nerve. They're not part of the sciatic nerve. They become the femoral nerve. 2, 3, and 4 become the femoral nerve into the front of your leg. So how do we know the difference? 3 and 4, they both cause pain in the front of your thigh. L4 will cross the knee to the inside of your calf. If the pain crosses the knee, it's highly unlikely it's L3. L3 doesn't cross the knee, L4 does. And that's how we know. So if you have pinching of the nerves from spinal stenosis, causing pain into the butt and down the legs, especially from standing, that goes away when you bend forward, it goes away when you sit down. The treatment for spinal stenosis, the most effective treatment is to do surgery to make more room for the nerves. This is a mechanical block of the nerves, and taking the pressure off the nerves has been shown to work better than anything. But there are risks of surgery. And there's no rush. If you don't have weakness, if you have a foot drop or quad weakness, you generally should have surgery sooner. But if you don't have weakness and it's just pain and you can tolerate it, you don't need to rush into surgery. But unfortunately, not a lot else treats the stenosis except surgery, because it's mechanical. The only thing that really helps is to bend forward a little bit. And that's what a lot of times people come into us and their spouse will say, yeah, they're walking bent forward. I try and get them to stand up straighter, but they can't because of the stenosis. So the only thing that helps is to mechanically relieve it. Doing physical therapy, getting your core strong, use our Back Doctor app, get these muscles strong can help, but it doesn't really mechanically help. When you stand up, the nerve still gets pinched. Doing epidural injections can also help temporarily. Cortisone shots to decrease some of the inflammation, but they don't change the MRI. They don't change the pinching of the nerve and the stenosis, but they can help, and typically they're very safe to do. I generally say if you got 3 epidurals a year and they lasted for 3 to 4 months and you didn't need to have surgery, that's reasonable to do. That obviously depends on each individual person's condition. So that's spinal stenosis. It's one of the things that limits people and is debilitating. Nerve pain that prevents your ability to stand is so debilitating, it's generally worth doing surgery for that. And that's probably our most successful surgery, because it's microscopic, minimally invasive, typically is an outpatient, and it really helps people stand and walk, which is such a basic human function. So you have 2 options at this point. One is you can email us at info@watkinsspine.com if you're interested in engaging more intimately. Or you can watch the next video on the treatment for spinal stenosis, which is either a fusion or a microscopic laminotomy decompressive surgery. Thank you.